Hello, my name is Dr. Joseph Giordano. I'm Professor Chairman, Department of Surgery at George Washington University Medical Center. I'd like to tell you about a unique opportunity for surgeons and a surgical team to provide desperately needed care to indigent people living in Guatemala. Over the next 5 minutes, you will see a description of that care and also learn about the impact that care has not only on the people of Guatemala, but also on the volunteers providing the care.
Centro de Salud Bárbara is a full-time clinic located in San Juan Zacatepeques in the western highlands of Guatemala, 1 hour northwest of Guatemala City. The clinic's surgical center is dedicated exclusively to making major medical care available to the most impoverished rural Guatemalans. Partner for Surgery is a nonprofit organization committed to facilitating surgical care for underserved Guatemalans and eliminating the barriers to access. Working in close collaboration, the two organizations have developed a model of delivering surgical care that combines the talents and resources of Guatemalan and North American volunteers. The premise of the model is that good health is a prerequisite for equitable economic development. The clinic environment is clean, orderly, and smoke-free. It is constructed, arranged, and maintained to ensure maximum team efficiency, as well as patient comfort and safety. The premises are contained on one floor with easy access between patient admissions, pre-op, operating rooms, post-op recovery, and patient ward. The operating suite has 2 fully equipped rooms, made possible by a grant from the Rotary Clubs of McLean, Virginia and Perham, Minnesota. Major on-site equipment includes anesthesia machines, laparoscopic towers, autoclaves, and backup generators. Diagnostic capabilities include X-ray, ultrasound, ECG, and standard laboratory testing. A surgical team has the option of bringing their own biomedical technician or contracting with one in Guatemala. The clinic offers on-premises sleeping accommodations if a volunteer needs or chooses to spend the night.
The facilities are outstanding. Again, you always have to be ready to adapt to things that are slightly different than what you have, but they've made them nice here, so there's very little adaptation in terms of the facilities. We have 2 large operating rooms, large enough for a team. Plus, we had medical students and Guatemalan nursing students and a lot of other observers that were maybe in the room at the same time. We didn't feel cramped. It's excellent. It's clean. Good sterilizing facilities. They have outstanding facilities for the patients. In the past, we've had the patients stay in a church with dirt floor perhaps, maybe cots. Here they have an outstanding concrete building with a formal kitchen, excellent washing facilities, nice bunk beds for them, and so they had it very nice, I think. And that's if we think about it being all about the patient, it definitely is here. Patients we are trying to serve, I would say, are generally the poorest of the poor. People that are disenfranchised even in their own country, people that are quite poor, maybe haven't seen a doctor except to do the triage out at the where they get evaluated first in the field, basically. Some of them have seen doctors. I don't mean that none of them have, but a lot of them, doctors are kind of a strange thing and a mystery, and we scare them to some degree. But they're extremely grateful for all we do for them, and as I said, they're the neediest of the needy. But the more you come, the more you can do. We're planning and hoping to do laparoscopic surgery next time, gallbladders and the like. There's certainly a large need for that. We've had, on previous teams, we've had gynecologists. There's a large need for facial plastic surgeons doing cleft lip, cleft palate work and that kind of thing. It's absolutely necessary to take that step, to stop thinking about doing it and actually do it. Now, nobody's helped by you thinking about doing it.
In some ways it's different. In a lot of ways it's because of how well the clinic's been equipped. It's comparable to the sort of places we work at in Canada. Certainly the population that we've been operating on this last week is different. They're certainly much poorer, and the conditions that they come in with are far more advanced when we see them here than we would see them in Canada. That's probably the biggest difference. We saw this place first. We've been here maybe 3 times over the last couple of years, looking at it, thinking what we could do, how we could equip it, how we could make it work. And when we first came here, this operating room, the 2 rooms, they were just a shell. No lights, no ceilings, no power outlets. And we came back, we thought we had a lot of potential. When we came back to Canada, we drew up a plan of how we thought it might work, and other people from Project Hands, Andrew Ray, particularly our treasurer, sent down some ideas